The runny noses, the sniffles, the cough and sore throat. If you have kids, you are probably dealing with one or all of these symptoms. Now, it's typical this time of year, but doctors say you need to keep a close eye on how long these symptoms stick around. You don't want it to turn into a sinus infection.
If your child is coughing for a month, you should definitely see a doctor. That is not a common cold. Common cold, 7 to 10 days.
According to the Centers for Disease Control, other signs of sinus infections include fever, nasal congestion and discharge, postnasal drip, sore throat, fatigue, and bad breath. The CDC says most sinus infections are caused by viruses, but can also be triggered by allergies, pollutants, and fungal infections. Yeah, you heard me right. Fungal infections can cause sinus infections. Yeah.
And one teenager knows firsthand he suffered for years, but fortunately he got to a specialist just in the nick of time.
Hey, Nicholas.
In 7th grade, Nicholas Pierre started having sinus problems. By his freshman year, problems progressed. He couldn't smell, distinguish tastes, breathe through his nose, sleep apnea, then headaches, then blurred vision.
The doctor says we're making preparations for Nicholas at Children's Hospital emergency room, that we found a tumor in his head, and oh my God, I went to pieces.
But doctors suspected something else and sent Nicholas to Dr. Adil Fatakia, an ENT and surgeon who specializes in sinus disorders. It was something else. The next day, he took Nicholas to surgery to make all of his sinuses wider. The specialist did all the surgery through the nose with no cutting on Nicholas's face or head.
In his case, we were fortunate enough that we caught it just before it seemed to have penetrated into the brain.
Nicholas had allergic fungal sinusitis. We all breathe this fungus normally in the air, but he is allergic to it. It caused all of his sinuses to become inflamed, blocked with mucus and pus, pushing so hard on the bones that his eyes grew wider apart, and it almost broke through the barrier to the sterile area of the brain.
I can't believe I was walking around for almost 3 years, 4 years with that and not noticing it.
As long as he's diligent with his rinses and topical medications, he should lead a significantly improved quality of life.
And the American Academy of Otolaryngology reports that in the past 30 years, there has been a significant increase in the number of recorded fungal infections or fungal sinusitis. The group attributes the increase to increased public awareness, new immunosuppressive therapies to prevent organ rejection, and overuse of antibiotics. Now, for some people, inflamed sinuses seem to be just a way of life. Chronic sinus infections come and go, and they are left to just ride it out time after time.
That is, until now. There's a new procedure being done that is changing the way ear, nose, and throat doctors treat habitual sinus problems.
Buford King has been suffering from allergies for nearly 25 years. From a stuffy nose to watery eyes to painful headaches, he's experienced it all. But after today, it's likely King may never experience a sinus infection again, thanks to a procedure known as balloon sinuplasty.
Hopefully it'll be over with and I can breathe.
Could feel a little pressure underneath your left eye.
The procedure's been around for a few years, but thanks to advancements in technology, it can now be done in the doctor's office instead of the hospital.
So this is one of the first things in a long time that has come out that really has been a game changer.
After numbing the sinus area, Dr. Webb inserts a small balloon into each sinus cavity, inflates it, and takes it back out.
You're not removing tissue, you're moving tissue over permanently with the balloon. So you're dilating those sinus openings to let them flow properly.
Doctors say for 95% of those receiving the sinuplasty, it'll be a permanent fix to allergy problems. Buford noticed a difference immediately.
I can breathe easier now than when he first started, because I was still semi-plugged, I guess. But
it's an innovative medical procedure that allows allergy sufferers to pay a visit to the doctor, often for the very last time.
And the recovery is very quick and get a really good response.
Just how quick is recovery? Well, Dr. Webb says most patients return to normal activity within 24 hours. If you're interested in learning more about balloon sinuplasty, an office here in Salisbury performs the procedure. You need to contact Eastern Shore ENT and Allergy. For more information, go to WBOC.com and click on our picture.
Well, for some people suffering from chronic sinus problems, breathing clearly can be a wonderful thing. Sometimes that congestion can be the result of allergies, even this time of year. That's because as we stay inside, we're exposed to more indoor allergens. We have some tips to keep you breathing clearer.
And just because the trees and grasses outside are dormant, that doesn't mean you can't get an allergic reaction. Find out what foods can cause the same reaction and how you can avoid it. But first, we just learned about sinuses and allergies. Dr. Oz has more on how we can fight winter allergies.
Hi, I'm Dr. Oz. Winter weather doesn't always mean the end of allergies. Spending more time inside means more exposure to indoor allergens. So here's how to avoid them. Make sure your heaters have HEPA filters to trap the dust and mold before it gets to you. And dust each week. Spots like bookshelves can quickly become breeding grounds for irritating indoor allergens.